Dr. Kenton Murphy is the Assistant Medical Director and Deputy Local Health Authority at Tarrant County Public Health. Dr. Murphy has agreed to help us consider the impact of the COVID-19 vaccine among persons experiencing a diverse number of health questions. I know that when our bodies are experiencing something like pregnancy, motherhood, illness, or another health concern unique to us, we want to be extra careful and learn all we can before making the choice to take the vaccine or have our children vaccinated. We are thankful for Dr. Murphy's careful examination of a variety of questions that have popped up around the vaccine and specific populations. Thank you, Dr. Murphy, for sharing your wisdom with us.
Well, thank you very much for having me. It is a pleasure to be here. Today, I'm going to be talking to you about COVID-19 vaccines and specific populations for COVID-19 vaccine. But first, just an overview of where we are. Today is Monday, May 17th, and this is today's statistics for COVID-19 disease within Tarrant County. We've come a long way over the last, definitely over the last year and a half, and definitely in the last 4 months in terms of number of new cases. To date, we currently have 87 new cases of COVID-19. Now, this is a remarkable achievement from where we were just 4 months ago. After Thanksgiving and Christmas 2020, we had at one point over 3,000 new COVID-19 cases a day, and we have completely dropped to, again, less than 100 cases, new cases of COVID-19 today. And that's all attributable to the COVID-19 vaccine. That is the reason why our new case rates have decreased. In terms of our ICU bed occupancy rate, it's at 85%. Again, this is a far cry from where we were 4 months ago when it was at 99.5%. We had in Tarrant County only 11 ICU beds available in all of Tarrant County. And now we're in the hundreds of ICU beds available. And that's, again, all due to our COVID-19 vaccination distribution. So we've come a long way since that time. So let's talk about our 3 major COVID-19 vaccines that are currently emergency use authorized by the FDA. They're Pfizer, Moderna, and Johnson & Johnson. Let's talk about Pfizer. Pfizer was our first COVID-19 vaccine that came out in December of 2020. It is an mRNA-based vaccine. It is a 2-shot series separated by 21 days apart. During the trial, they looked at well over 30,000 participants of all ethnicities and races that did the trial participant. After the first shot, they found that this was close to 90% effective after the first shot. And after 2 weeks after the second shot, they found this was 95% effective. In terms of side effects are more of an immune response. So we call them side effects, but really it's your immune system responding to this vaccine, which is essentially what we want. And so some people, not everybody, but some people get a pain at the injection site, maybe some soreness of the arm, sometimes fatigue. Others get body aches, chills, and maybe a fever. They tend to come on about 6 to 12 hours after the onset of the vaccine, and they last anywhere from 1 to 3 days. They're short-term and they're not long-lasting. Our next vaccine, which came out, was the Moderna vaccine. This too is an mRNA-based vaccine, very similar to the Pfizer vaccine, just with a few minor different ingredients. This too is also a 2-shot series. This one is taken 28 days apart from the first one. They also got over 30,000 trial participants of every ethnicity and race. After the first dose, they found it was 80% effective, although newer data shows that it's closer to 90% effective, just like Pfizer. And after 2 weeks after the second dose, it becomes 95% effective. With Moderna, Moderna and Pfizer both require very cold storage. So they need minus 70 to minus 80 degrees Celsius freezers to keep it stable. And so they require much cold storage temperatures than some of the other vaccines. In terms of its side effects and immune response, because it's an mRNA-based vaccine, you would expect very similar side effects to Pfizer, and that is true. Again, they include pain at the injection site, maybe soreness of the arm, sometimes fatigue, Also included body aches, chills, sometimes a fever of 100 degrees or more. Again, it comes on about 6 to 12 hours after the injection, and they last anywhere from 1 to 3 days. Our third and final vaccine that's approved here in the United States under emergency use authorization is the Johnson & Johnson vaccine. This is not an mRNA-based vaccine. This is a different mechanism of action to produce the antibody to protect us against COVID-19. Uses a empty adenovirus shell. This has been shown to, after the first shot, to be 75% effective in the reduction of COVID-19. And I'm going to talk briefly about effectiveness in just a bit. However, what's important, not just Johnson & Johnson, but for the other two as well, Moderna and Pfizer, the studies at the time showed it was 100% effective in reducing hospitalizations and deaths during the trial participant. Now, flash forward to today, the data is slightly different. We have now real world data. Out of 115 million people that have been fully vaccinated with either Pfizer, Moderna, or Johnson & Johnson, we've had a little over 6,000 people become infected with COVID-19 despite being fully vaccinated. That attributes to a 0.006% chance of getting COVID-19 even after you get fully vaccinated. We've had a little over 100 deaths despite people getting fully vaccinated. Again, so compared to the amount of people that have been fully vaccinated, it's a very small amount. And the people who have died despite being fully vaccinated are generally those who they were all above 60, and they had very severe chronic diseases. So it brings me to my next point of just briefly talking about what effectiveness is. Overall, in general, if you have a vaccine that's over 50% effective during a trial study, that is very good. Effectiveness basically means is they look at both two populations. They look at a population during a trial of people who did not get the vaccine, and then they look at a population of the people who did get a vaccine. And then they compare the two groups after some time, and they see what was the reduction of COVID-19 disease between those two groups. So with Moderna and Pfizer, they found overall it was 95% effective, meaning without a 95% reduction in COVID-19 disease between the trial group and the control group. And in Johnson & Johnson, they found a 75% effective rate, a reduction in disease. So we often compare these two because then we'll say, well, one is not as effective as another, but that is incorrect. If you look, again, real world data, it doesn't translate to how many people actually get COVID. So even after getting fully vaccinated, your chances of getting COVID are extremely small. Again, out of 115 million people who have been fully vaccinated in the United States with any of these three vaccines, only a little over 6,000 have actually contracted the disease. And the far majority of those who got COVID-19 were not hospitalized and they recovered fine. So again, effectiveness and real world translation of getting disease after fully vaccinated is a little different. So if you're, again, above a vaccine is over 50% effective, it's a very good vaccine. So going back to Johnson & Johnson, again, it's a single shot. Its storage requirements are very easy. It only needs to be stored in a normal fridge, doesn't need the deep freezer requirements. The good news about Johnson & Johnson and the other two COVID vaccines as well is they protect against the new variants that are coming out, UK, South African, the California variant. They do a fairly good job of protecting against those other variants. Side effects of Johnson & Johnson, very similar to Moderna and Pfizer. Again, pain at the injection site, some soreness of the arm, maybe fatigue. And some people have gotten body aches, chills, and a fever. You might recall at Johnson & Johnson, we had a brief pause of this vaccine because there was 6 adverse events that were reported in the United States. Specifically, they were 6 people who got a rare blood clot and low platelets about 6 to 18 days after receiving this vaccine. So because they popped up in our surveillance, immediately the United States put a pause on the Johnson & Johnson to further investigate. These 6 people got this rare blood clot, and this was 6 people out of 6.8 million doses that were at that time, at the end of March, that were given in the United States. The blood clots were a rare blood clot called cerebral venous sinus thrombosis, and they also had a low platelet. For this rare blood clot, the people that got it were already people who were at risk for contracting this rare blood clot, low platelets, and they were all women. They were Caucasian. They were between the ages of 18 and 48, so they're within childbearing age. And amongst those 6 women, 1 was fatal and 1 was ICU. But after doing a further investigation, the FDA and CDC both did a further investigation into this to see whether this was just these women were going to get these blood clots anyway, or was this attributable to Johnson & Johnson vaccine? They saw it was background risk, and they realized that, and they recommended that Johnson & Johnson, the benefits of the Johnson & Johnson vaccine far outweighed the risks, and so they continued. And so currently Johnson & Johnson is again approved for emergency use authorization, and we are currently giving it out here in Tarrant County. So those are our 3 vaccines that are currently approved in the United States for emergency use authorization. Let's talk about some specific populations amongst our COVID-19 vaccines. Let's talk about pregnancy. So let's talk about first about pregnancy and COVID-19 disease. What do we know about pregnant women who contract the COVID-19 disease? We know that pregnant women who contract COVID-19 at any trimester were more likely to be hospitalized and require ICU admission than non-pregnant women. Of these, 55% of the hospitalized patients were asymptomatic, and 20% of the hospitalized women had underlying medical conditions. Also, in terms of pregnancy and COVID-19 disease, there was a 2% pregnancy loss. So data has come out, some mixed data showing that women who contract COVID-19 disease had a small increase in either preterm labor or preterm delivery and or miscarriages or spontaneous abortion. And there's still data being investigated. And there's limited information about whether COVID-19 is associated with, again, with pregnancy loss, miscarriage, or stillbirth, and we're still looking into it. So we know, though, that though pregnant women who contract COVID-19, it doesn't always fare out well for those who are not pregnant. So let's talk about our COVID-19 vaccines now and pregnancy. Both the American College of Obstetrics and Gynecology, the CDC, both of them recommend that the COVID-19 vaccine be given and offered to pregnant women. The WHO, the World Health Organization, back in January, offered some caution about the vaccines, and just because they offered caution because there was not enough data at that time to fully recommend pregnant women getting the vaccine. They just offered that women discuss it with their obstetrician, and they weighed the risks and benefits. But again, the American College of Obstetrics, CDC, FDA both recommend that pregnant women, that the vaccine is offered for pregnant women. We have currently underway phase 2 safety data from Pfizer and Moderna, actually, and to see about the safety of COVID-19 vaccines and pregnancy. And that data is going to be fully coming out in July or August of this year. We know, based on anecdotal data and the amount of women that we've here in Tarrant County and the United States have given the vaccine to pregnant women, that they far above, they do very well. We've had no reports of any miscarriages from the vaccine or any adverse events from the vaccine. By and large, all women have done well. As a personal anecdote, my wife is pregnant. She's about 2 weeks away from delivery, and she too got the COVID-19 vaccine back in December, and she did very well. Her and baby are doing well. Some great news, though, about COVID-19 vaccine and pregnancy is that the new data is showing that COVID-19 antibodies are actually being found in the umbilical cord blood for those who got vaccinated. This suggests now that it's possible that the babies that are being born to COVID-19 vaccinated mothers are going to be protected from COVID-19, which is just great news to hear. So another important reason why pregnant women should probably get the vaccine. The timing of the COVID-19 vaccine is still being researched. In other words, what trimester? Is there a better trimester, getting it early or late? That's still being debated, and we don't know. At this current time, it's just recommended for pregnant women at any trimester to talk to their obstetrician first and get the COVID-19 vaccine. We also see that COVID-19 vaccine is protecting against some of the new variants that are coming out. That's what makes this very important for our pregnant ladies to get the COVID-19 vaccine. Any one of the three, Moderna, Pfizer, or Johnson & Johnson. Let's talk about breastfeeding COVID-19 vaccine. This is breastfeeding COVID-19 vaccine is very safe. So if you're a breastfeeding mother, it's very safe to get the COVID-19 vaccine. The latest data is showing antibodies that are being created for the COVID-19 vaccine are actually being given out into the breast milk, and it's being passed on to the newborn. And it's about 6 weeks after the vaccination, after the beginning of the second dose of Moderna Pfizer, or the first dose of Johnson Johnson, or the one and only dose of Johnson Johnson. 6 weeks later, we're seeing robust antibody response as being secreted into the breast milk and passed on to the newborn. So that's great. We are now, while there's still data and we're still doing research on whether those newborns who are getting breastfed from women who've been vaccinated and or pregnant women who are vaccinated and delivering, whether those infants are protected now from COVID-19, but based on our previous history of other vaccines and passing down to fetuses, we believe that's true, that is going to happen. So it's yet another reason for breastfeeding mothers and pregnant women to get vaccinated, because we're now passing that protection on to our newborns and our newly born babies. So very important and very exciting data that's coming out. Let's talk about specifically children and COVID-19 disease. In general, overall, kids who do contract COVID-19 disease typically do not become as sick as adults are. They generally are either asymptomatic, meaning they show no symptoms but carry the disease, or they have very mild symptoms like mild cold-like symptoms or allergy symptoms, but then they're passing it on to their parents and grandparents, who are then taking the brunt of this disease. Now, that being said, there are a small subset of children who can develop really bad COVID-19 disease, specifically a disease that we call MISC, or multi-system inflammatory syndrome in children. Essentially, what it is, it's basically like an autoimmune disorder where certain organs like the heart, lungs, kidneys, brain, gastrointestinal tract, they all become inflamed. We don't exactly know the cause, but we know it's associated with those who've either contracted COVID-19, so the kids who've contracted COVID-19 recently, and or who have been exposed to COVID-19 from someone else. Most of the time, most of the children recover, but there have been a small subset that have died from MISC. So the COVID-19 disease with children is just not a good thing. So it's very important that we get them vaccinated. And sure enough, now we're working on that. So as of now, the FDA has approved for emergency use authorization for the Pfizer vaccine to be given to 12 to 15-year-olds. Originally, Pfizer was only for 16 years old and up. Now it has been approved for 12 to 15-year-olds, and it's the only vaccine currently available to our adolescent children. Moderna is still only 18 years and up, and so is Johnson & Johnson. So Johnson & Johnson and Moderna are both 18 years and up. Pfizer right now is 12 and up. So we are currently giving out in Tarrant County the Pfizer vaccine to our 12-year-olds and up. Studies are being conducted right now, both for Pfizer and Moderna, to look at 6 months of age and up. So the data currently, the preliminary data looks really good and really promising, and it looks like it's on track to be approved by emergency use authorization by September. So we think somewhere by September we'll have a COVID-19 vaccine for our young children, which is exciting news. And then Pfizer has already applied for now full approval of their COVID-19 vaccine. They've submitted the paperwork. So remember, currently all the vaccines are approved under emergency use authorization, which just means because we're in a pandemic, we can give the vaccine. But now they're looking for full FDA approval for Pfizer by the end of May. It looks promising, and looks like it'll be approved in just the next couple of weeks. So, which is great news. And Moderna will be right around the corner. So again, getting our children vaccinated is going to be very important to reducing our pandemic, because we're going to have less people contracting this disease. In terms of immunocompromised and COVID-19 vaccines, let's talk about immunocompromised conditions first. Well, who is immunocompromised? Well, they can be a variety of things, from congenital conditions, so you're born immunocompromised, leukemia and other cancers can cause it. If you have cancer and you're getting chemotherapy, radiation, or biologics like Humira for either cancer treatment or other autoimmune disorders, you're considered immunocompromised. If you have HIV or AIDS, specifically AIDS, if your CD4 count is less than 200, you're considered immunocompromised. If you have an organ transplant, kidney, liver, and you are taking immunosuppressants, you're considered immunocompromised. So overall, the COVID vaccine, all three, Johnson & Johnson, Moderna, and Pfizer, are considered very safe. And it's very important that our immunocompromised community get the COVID-19 vaccine because it does offer some protection. However, that being said, there is some mixed data, again, not on the safety of the vaccines. They're very safe for our immunocompromised population, but some mixed data on how robust this vaccine is. We know it offers some protection, but what we're seeing, the data showing that those who are truly immunocompromised and have a hard time developing antibodies anyway, don't produce the full protection from these vaccines as one who's not immunocompromised. So about 39% of solid cancer patients and 13% of people with blood cancer showed an antibody response compared to 97% of healthy people. And about half of organ transplants showed an antibody response after 2 doses of the mRNA COVID vaccine. So again, it's not offering the full robust protection for those who are not immunocompromised, but it's still showing some protection. And so that's why it's very important to get the vaccine. So some questions may come across. Well, when should I get the vaccine if I am immunocompromised? And this is not based on any specific data about COVID-19 vaccines, but just on general best practices. So in general, when we're giving vaccines to our immunocompromised community, we tell them to try to get it at least 2 weeks prior to the initiation of their immunosuppressive therapies, if that's possible. So try to get it 2 weeks prior to cancer treatments or radiation treatments or chemotherapies or any biologics being used, if you can. But if you can't plan for that, in other words, you have to get it, you don't want to delay unnecessarily any type of therapies for cancer or autoimmune disorders, then if you can't delay it, get it and just get the vaccine anyway. So if it's not possible to plan ahead and get the vaccine early, then just get the vaccine at any time, even if you're taking immunosuppressive drugs at the time, or steroids or prednisone, any of those, you should still get the vaccine. And what we're informing our immunocompromised community, that even if you get fully vaccinated, you should still continue to socially distance, mask, and do hand sanitation, like wash your hands and use hand sanitizer. Because again, we are seeing in the data that those immunocompromised people are not producing the full robust protection as the non-immunocompromised population. Still getting some protection, and there's no adverse reaction, so some protection is better than none, and there's really zero risk. So that's why it's very important to get vaccinated, but you still have to do the masking, social distancing, and hand washing until we get more data that maybe says otherwise, or come up with specific criteria for immunocompromised. Some ideas that are being thought of right now, but not approved just yet, are possibly getting a third shot for our immunocompromised, or using a different type of vaccine for our immunocompromised, like they do in Europe. So in Europe, for example, they do a third booster for the immunocompromised people, and they tend to mix and match. So if one got Moderna, they'll mix and match with the Johnson & Johnson months later. So again, that's in Europe, not the United States currently, but they're debating it currently here in the United States and just waiting for more data. So what if I already had COVID-19? So if you were unfortunate and contracted the COVID-19 vaccine, if you're unfortunate and you contracted the COVID-19 disease, you should also get vaccinated. It's very important that you get vaccinated. Now, when should you get vaccinated? Well, if you're acutely ill with COVID-19 disease, definitely don't leave your house. So If you are acutely ill with COVID-19, you need to stay home and stay away from people and isolate yourself until you have recovered, which is in general about 10 days after the onset of symptoms or 10 days after a positive test. Once you are past the acutely ill period, then you can get the COVID-19 vaccine. Now, there's no minimal interval that is suggested between the disease and getting the vaccine. However, based on previous experience with other vaccines and other our current evidence with COVID-19 disease, we know that the risk of reinfection after contracting COVID-19 disease is fairly low in the first 90 days. So there's some recommendation by the CDC to wait at least 90 days before you get vaccinated. However, that is just a recommendation and not the contraindication. So as long as you're past the acutely ill period, you can immediately get vaccinated, though you may want to wait 90 days so that you can get the full robust protection from that vaccine. However, if you received monoclonal antibodies or convalescent plasma as part of your COVID-19 treatment, it is definitely recommended to wait those 90 days after initial therapy. Again, it's not a contraindication. So in other words, we're not saying no, but it's highly recommended that you wait 90 days if you receive some sort of antibody treatment or plasma treatment because you were very ill from the disease. We want to wait those 90 days so that those antibodies from the monoclonal antibody and the convalescent plasma kind of die down. And then when we give you the vaccine, you'll have that full robust protection as everybody else. But again, these are just recommendations, but if you're itching to get the COVID-19 vaccine and you just got infected with COVID-19, wait your acutely ill period. Once you're free from isolation and quarantine, you can go and get your vaccine, and highly recommended you do. So a few things I want to talk about. Well, how did we get a COVID-19 vaccine so fast? That's commonly brought up. Well, the long story short is basically the whole world stopped what they were doing and focused on getting a COVID-19 vaccine. So when this pandemic occurred, the entire world, the smartest people in the world who were working on cancer research, HIV research, any other types of biologic and scientific research, stopped what they're doing and focused on getting a vaccine as fast as possible. Plus, all the governments in the world put up basically billions and billions of dollars and unlimited resources to get the COVID-19 vaccine. So this essentially was our 1960s moonshot. The United States wanted to go to the moon in the 60s. This is what we did here in 2020, is we said we're going to develop a vaccine. And that's how we became so successful. That's basically the long story short, is we put all our resources into getting a COVID-19 vaccine. We also had some previous experience with the mRNA vaccine from SARS and MERS, which are genetically similar to COVID-19 disease. So we had some previous research on mRNA vaccines that we got to leverage, so that helped. And again, just all the money of the world and all the smartest people in the world decided to create a vaccine, and so they did. So it just shows you the human ingenuity. We put our minds together on a problem, we can solve it very fast. And that's how we got this vaccine relatively fast. So I'd like to talk about some myths that I've heard about over the course of the year and my experience here at Tarrant County, and just kind of put them to bed. So I have 9 myths here that I'd like to talk about. Myth number 1 is that we can't trust these vaccines because they were rushed. Well, I mentioned that in the last one. They weren't rushed. And what's very important to understand is even during the trials, the safety data, the safety trials were never rushed. The safety trials were still performed at the same amount of time as all the other vaccines that we do. They were not rushed. We just happened to do the safety trial because we had, again, previous experience with these mRNA vaccines and a few of these vaccines that we knew they were safe. We did the safety trial and the efficacy trial at the same time. That's how we were able to get a vaccine within the year. But the safety data, the safety trials, none of those were ever compromised. So that's very important to understand. But again, when you have all the money in the world and a lot of the smartest people in the world developing something, you can solve it, and that's what they did. Myth number 2, the vaccine will give me COVID-19. No, that's impossible. This is not a live virus vaccine. This is just parts of the vaccine. For the mRNA-based vaccine, they're literally just parts of a genetic code or parts of genetic material, really, and that encode for proteins, but they do not give you the vaccine, or they cannot give you the virus. It's impossible. Myth number 3, we don't know what's in these vaccines. That's false too. One thing that was great about these vaccines is every developed country was fully transparent with not only how they created them, but how they approved them. So if you go online, you Google the vaccine and type in ingredients, it'll list on the emergency use authorized form all the ingredients for all the vaccines. So we know exactly what's in them. And this is an example of Moderna vaccine, what's in them. Essentially, it's lipids and cholesterol and fat surrounding a small piece of genetic material that is in there that encodes for these proteins. And that's pretty much it, but it's all been very transparent. If you want to review and look at the video that during the debates about whether they should approve them here in the United States, that's also online as well. You could watch the entire video of how they improve them. If you want to come up to your own conclusions about from the data, from the raw data, that's online too. So you can see the raw data from the trials and start coming up with your own conclusion of whether they're effective or not. So it's all very transparent. That's been fantastic about these vaccines. Myth number 4, these vaccines will alter my DNA. No, that is incorrect. It's important to understand that mRNA vaccines are not DNA vaccines. So they're not DNA based. I know they sound alike and we use the term genetic material because that's kind of what mRNA is, but it is not DNA. In fact, DNA and RNA inherently do not like each other. They repel each other. They're both negatively charged and they cannot get close to each other. They completely repel each other. So it's impossible for an mRNA-based vaccine to enter the cell nucleus and alter the DNA. That's a myth that was born out of not enough knowledge. So they can't modify any cell DNA. Myth number 5, I already had COVID-19, so I won't benefit from the vaccine. We talked about this previously. No, that's incorrect. And the reason why is because when you contract COVID-19 naturally, you caught one variant of that disease. Well, we know there's the UK variant, the California variant, the South African variant. There's all these different mutations in the COVID-19 disease. And so, a couple months later, 3 months later, you can contract it again. And we have seen that. We have seen that firsthand where people in Tarrant County have contracted COVID-19 2 times, 3 times. And unfortunately, sometimes they don't do so well on the second or third time they've contracted COVID-19. We've seen people die when they've caught it the second or third time. We also have something called the long haulers. You may have seen that in the news. Long haulers are people who've contracted COVID-19 but continue to have symptoms of COVID-19 3 months, 6 months, 9 months, a year later. They're still having COVID-19 symptoms, and we don't understand why. So by getting the vaccine, not only will you be benefit because you won't have, it'll cover you for more of the variants, but you're unlikely to contract it, and so you're unlikely to get the long hauler disease. So and the long hauler syndrome. So that's why it's very important to get vaccinated. If you already had COVID-19, to get revaccinated, to get vaccinated so you won't get reinfected later. Myth number 6, since COVID-19 survival rate is so high, I don't need a vaccine. It is true. The vast majority of people who contract COVID-19 disease don't become fatal and don't end up hospitalized. The vast majority do get better. Now, and it is also true our mortality rates have decreased. At one point, early on the pandemic, our mortality rate in the United States was between 7 and 10%. Currently, it sits at a little less than 1%, and that's for a number of reasons. Less elderly people are getting infected now. More of the young people are getting infected. Also, our therapeutics for COVID-19 have become more robust, and we're getting smarter on how to specifically the timing of treatment for COVID-19. So we've gotten better, that our survival rate has gotten a lot better. However, again, we don't know why some young people die from COVID-19. We don't know why some of the young people who have no other comorbidities, no other problems, are getting hospitalized and getting ventilated and dying. So because we can't figure that out, and that's happening, and also because that long hauler syndrome, where some people are getting COVID-19 symptoms for a year out, it's very important for you to get vaccinated so you don't get any of those, because we don't fully understand why people who contract COVID-19 disease are having still some symptoms or dying even if they're young. So very important to get the vaccine. Myth 7, once I get vaccine, I won't have to wear a mask or worry about social distancing. I guess we're there now. We just a week ago we weren't there, but yes, now the CDC has said if you are fully vaccinated, and let's define what that means. Fully vaccinated means it's 2 weeks after your second dose of Moderna, Pfizer, or 2 weeks after your first and only dose of Johnson & Johnson. Provided you are fully vaccinated, you no longer have to wear a mask indoors or outdoors amongst people. So again, this was incorrect just a week ago, but now you can. So that's another great reason, if not the only reason, to get vaccinated is once you're vaccinated, you can take that mask and burn it up. Now, there are certain instances where one should still wear a mask, and they recommend planes, public transportation like buses, subways, things like that. So basically where you're in a very close commute, like a close number of people, where a lot of people around you in a small enclosed area, then you should definitely keep your mask on. But in lieu of that, no, go hug your loved ones, go meet up with friends that you haven't done before. So this is great news now. And as long as people continue to get vaccinated, this pandemic will be behind us in no time. Myth number 8, the government is tracking my whereabouts with a built-in microchip in the vaccine. I like this one. This one's my favorite myth. That is obviously false. This came about because Bill Gates, months ago, or maybe 6-7 months ago, talked about vaccine passports as a way to keep track who got vaccinated and who didn't, so that we could kind of enter society safely. But there is no built-in microchip or anything in the vaccine. That is completely false. And don't forget, your phone, Facebook, Google, they know more about you than any vaccine ever will. So don't worry about that. Myth number 9, the vaccine causes infertility. This came about, I think people got confused with the mRNA vaccine and it being introduced, going into your cells and altering your DNA. Obviously, that's all false. And so that came out saying, oh, people are getting infertile, and that's incorrect. So there's no reports of any infertility, and we've given out 115 million people have been fully vaccinated in the United States, and there's no single case of infertility due to the vaccine at all. So those are our 9 myths. I just want to end with where we are today in Tarrant County with our COVID-19 statistics. Total doses administered, and this is just great news. Total doses administered in Tarrant County is over 1.2 million doses of COVID-19 vaccine here in Tarrant County. That's just remarkable. That the number of people that have been wanting to get vaccinated. We still have a long ways to go. About 28% of the population have had at least 1 dose. 22% of our population has been fully vaccinated. So we still have a long ways to go, but it's been very encouraging to see our citizens and residents want to get vaccinated. At the very early stages of giving out the vaccine, we saw these long lines. Some people waited 30 minutes. Some people waited hours to get their vaccines. And it was encouraging. People were waiting and they wanted this vaccine. And so it's been great to see the response from the community about getting the vaccine. Fast forward today, we ourselves have lots of vaccine available and we have no line anymore. In fact, to register, you don't have to register online if you don't want to. You can actually walk into any one of our mass vaccination clinics and they'll register you right there on the spot, get you your vaccine, and you're in and out. So what used to be hours of lines now turns into just minutes. So because we have so much vaccine available. And so I encourage everyone listening to this is please get vaccinated. We're so close to ending this pandemic. The more people that get vaccinated, the closer we are to getting life back to normal. And I think we could all use that, especially after over the year that we've had dealing with this. It's just nice to have some good news and see a light at the end of the tunnel. So I appreciate your time. If you have any questions, you can always contact me. And then please go to our website, coronavirus.tarrantcounty.com, and you can see how to register, or if you want to pre-register for the COVID-19 vaccine and where our COVID-19 vaccines clinics are. So thank you very much for your time.